an anti-vaxxer. Okay, I'm a disabled veteran. I've had every vaccine that you could imagine, and I vaccinated all my children. Why? Because I was a knucklehead. I was an idiot, and I believed everything that I learned in medical school and everything that the CDC and the FDA and my organizations shoved down my throat. And I was in that system, and it wasn't until the turn of the century that I started to wake up and question. And, since then, I even pushed vaccines in pregnant women, influenza and DTaP. And, shame on me, mea culpa, and maxima culpa. I probably hurt a lot of mothers and fetuses, and for that, I'm very sorry. I haven't pushed any vaccines for the last at least 10 or 15 years because I had an awakening. I saw the corruption of the medical industrial complex, the FDA and the CDC. I looked personally at the New England Journal of Medicine and the editor-in-chief at the turn of the century, Marcia Engel, who said they were corrupt and they were a corporate kleptocratic machine involved with the federal government and the pharmaceutical companies. Since then, I've done an about-face. Don't ever take a vaccine in pregnancy. There are no randomized, double-blinded, placebo-controlled trials of any of the 80 or 90 vaccines on the FDA schedule. Not a one. If you don't believe me, read the book, Turtles All the Way Down. Okay, Vaccines, Science, and Myths. There has not been one. This has been controlled by the pharmaceutical medical government complex. And by the way, the FDA and CDC have 50% or more of their income coming from vaccines and from vaccine royalties. So as of last year, the vast majority of Americans know that it's a sham. They don't believe their government. Now they're staying silent because it's taboo and they don't want to get in trouble. But the fact of the matter is, the uptake of the COVID-19 vaccine boosters last year was a pathetic single digit. Okay, some say 1%. And I can tell you, I'm in practice in a huge Midwestern city right now in a conservative area. I also live in Florida with my wife, Maggie, around the Pensacola area. But up here, nobody's getting the vaccines. Nobody. And what this has done is it's opened up Pandora's box for the American people to now realize that it's not just the COVID-19 vaccine that's a sham. For my patients that ask me, what about the vaccines in the first year of life? I'm saying, don't ever take anything a vaccine in pregnancy. Do not take the hepatitis B vaccine the first day of life for your baby. That's a complete joke. And off the record, I think each of these individual vaccines need to be looked at very carefully. What we do know, I would urge all of the viewers to look at Dr. Peter McCullough's YouTube video. They're actually letting him on YouTube video now. It's a 28-minute video summarizing the evidence of the vaccine and autism and these adverse neurological sequelae in children. I think that it's really important. Nowhere else in medicine does a doctor take 16 shots, these vaccines that are piled up in one visit and give them all to all patients at the same time. And that's really what the pediatricians are doing. I would never, nor would Dr. McCullough take 16 drugs and say, here, you have to take this today. One size doesn't fit all. What we do know is the later, the more you delay and the fewer you give, the lower are the risk of these severe neurological diseases. And by the way, also sudden infant death syndrome. 80 to 90% of sudden infant death syndrome occur within 7 days after the vaccine.
Wow.
I'm not an anti-vaxxer. Okay. I'm a disabled veteran. I've had every vaccine that you could imagine, and I vaccinated all my children. Why? Because I was a knucklehead. I was an idiot. And I believed everything that I learned in medical school and everything that the CDC and the FDA and my organizations shoved down my throat. And I was in that system. And it wasn't until the turn of the century that I started to wake up and question. And, since then, I even push vaccines in pregnant women, influenza and DTaP. And, shame on me, mea culpa, and maxima culpa. I probably hurt a lot of mothers and fetuses. And for that, I'm very sorry.